Thank you for the chance to present our work. I'm here presenting on behalf of Dr. Garcia-Rodriguez, and grateful for the opportunity. So 4D Flow MRI is increasingly used to at least attempt to characterize hemodynamics in type B aortic dissection. We get very beautiful pictures, and it's hard to look at these and not believe that there's some additional information to be gained from this modality. However, to fully realize the potential benefits of this technique, prospective studies are needed, multi-center prospective studies are needed, but that comes with a whole set of questions like what velocity encoding strategies, how does different 4D flow sequences, how do sequences impact the hemodynamic parameters that we characterize, and are there variability between vendors and sites. And so we thought, can 3D models potentially be useful to help answer some of these questions? And so we first just wanted to get a handle on what 3D models actually can do in type B patients. So we retrospectively identified 2 type B aortic dissection patients that had in vivo 4D flow performed as part of their sort of clinical evaluation, and then generated 3D printed models of these 2 patients using either high resolution CT or MR data, and then performed in vitro 4D flow, both at low and high velocity encoding strategies, 70 centimeters per second and 150 centimeters per second in both patients, using a PC Viper 4D flow technique with 1.25 millimeter isotropic resolution. Notice there's a little bit of a difference between the in vivo and in vitro velocity encodings. And then finally, for post-processing, we segmented out the false lumen and then performed a velocity histogram analysis within the false lumen. And the results were actually pretty promising, we felt. You can see here the in vivo studies, the top row, and then the low and high Vanc studies are the middle and bottom rows. And the red line there is median velocities in the false lumen. The blue line is peak aortic flow rate. And you can see the parameters between all 3 sets of data are actually, the trends are quite similar while some of the raw numbers are different. We feel this is an encouraging step to say maybe we can use this to optimize our sequence, our planning across multiple sites and vendors. So that's all. Thanks.